Hello, today is November 15th, 2020. My name is Juliana Castro. I'm interviewing Christopher Castro for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Mr. Castro, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at the UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes.
Yes, I agree.
I agree.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
Okay, as you recall, we previously filled out a pre-interview form. We use information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask your consent on what I just described. Do you wish for us to share the rest of your interview and your public files available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions. I will now ask. Okay, Christopher, thank you so much for your time. And I just wanted to remind you that your stories and experiences are valuable to us at UTRGV Special Collections and Archives and the Voces Project. Particularly for us at UTRGV Special Collections, we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those who work closely with these populations during this COVID-19 pandemic. Because you are a registered nurse working hands-on in the front lines of this pandemic, your experiences and stories are particularly valuable for anyone in the future who would want to gain real insight on the history of the COVID-19 pandemic. Okay, so let's just start off with you telling us a little bit about yourself. Who is Chris Castro? Who is Christopher Castro?
I am a 32-year-old father of two, been a registered nurse for 4 years, come from a small family of five, small town. Family is very interconnected in my life. All about family.
Where are you from? Where did you go to school?
I went to La Villa High School, graduated from La Villa High School in 2006. I attended South Texas College, which I graduated in 2015 with my associate's degree in nursing. Right after that, I started working at a nursing home, Alfredo Gonzalez, for about 8 months. And my current job, I've been at Rio Grande Regional Emergency Room Nurse for 4 years.
Okay, awesome. So let me go ahead and jump to the question. So the first question I want to ask you is, when did you first hear about COVID-19? And how did you learn about it? Like the radio, TV, social media?
I think like everyone else, TV, CNN was talking about an outbreak of a virus we've never heard of in China. It was not supposed to reach our shores anytime soon, so none of us really were worried. Our hospitals didn't really prepare for it. It was something that we kind of brushed off.
Okay. So I was going to ask, what was your first reaction to the information, like about COVID-19?
I heard about this. I heard the way it was spread and, the actions they were taking in China, how quickly it spread and how deadly it was. To be honest, being in healthcare, it was hard to believe that something can kill someone so fast. And it was scary, but it seemed like it wasn't isolated to only China. It didn't seem like it was going to make it to our shores.
And at what point did you realize this pandemic was a serious life-altering event?
It happened, I would say, I guess in January when there started to be slow rises in cases. Now it didn't hit the Rio Grande Valley for us until maybe late June, early July. And in that time between January and July, hospitals were starting to cut hours for nurses because it wasn't, we just weren't having the volume that we normally used to. So it was hard. We didn't have enough staffing, things like that. And then in June, when we saw cases go from maybe 4 or 5 a day to 30 to 40, holding patients in our emergency rooms for 10, 12 hours, even 2-3 days. That's when we knew this was very real, very deadly, and we were very ill prepared for it.
Okay, so over the last few months, what news media or social media or other sources do you rely on to keep you informed about coronavirus?
Just any major news networks. Our local news kind of gives out numbers daily on cases that have gone up, deaths, But like I said, being in healthcare, you're right in front of it. You know exactly what's going on. You know the trends. You know where it's going. So, I'm right there. I don't really need to see news to know what's going on. I have friends in other hospitals that tell me, hey, this is starting to pick up. Be careful, because I myself contracted COVID-19 in July 4th, to be exact. My wife and I.
And can you share with me what you understand about COVID-19 as an infectious disease? And likewise, what you don't understand about this new virus?
I think that the pathology of it is just so different. It's always changing. There's nothing that can pinpoint it exactly. You know, they say it's a respiratory illness that attacks the lungs, but then they say it might be a bloodborne infection that starts small clots in the body. It's just, it affects so many things in so many different ways, and it affects so many different age groups, genders differently. It's just hard to pinpoint, but to answer the question, they maintain it's a respiratory illness that causes hypoxia, which is decreased oxygenation, which leads to respiratory distress, which means it's very hard to breathe. It causes inflammation. It can cause inflammation in the lungs, which causes fluid buildup in the lungs, which makes it even harder to breathe. So there's always supplemental ways to help them. There's a thing called a BiPAP, which is basically a mask that they put on someone, and it blows air to keep that pressure in the lungs, kind of keeps it open. And there's always our very last option is always mechanical ventilation.
Would you take the first COVID-19 vaccine available on the market? Why or why not?
I've actually had this discussion with my wife, and she says no, that she would not. I don't know yet. You know, it just seems like it's been rushed. You know, I need to see more information on it. I'm not one to just take something just to take it. You know, I'm okay with the flu vaccine because, I mean, the flu vaccine's been proven. It's been given for years. It's been studied. You know, this kind of just seems like it's been rushed a little, and I just want to know a little bit more about it before I can take it myself.
Do your family hold the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly?
I think, you know, my sister and I are both nurses, and we stress upon our family members how important it is to social distance, to wear your masks. I think that all my family members know, through whatever stories I may tell them, how serious this can be. My mother and father having comorbidities that make them more susceptible to COVID-19, being diabetes, hypertension. You know, I really stress upon them the importance of them social distancing, wearing masks. And in times we have to be brutally honest with our family members and tell them they could die from this disease if they don't take it seriously.
It's usually how it is in Mexican American families. Okay. So the next set of questions I'm going to ask you are going to focus on your experience on the front lines of this pandemic, since you've seen firsthand through your career how people have been affected along with yourself. So let's start off with you telling me, where is it that you work?
I work in the emergency department. I'm the charge nurse, which basically means I help run the ER along with our clinical managers. I have at any time maybe 6 to 10 nurses working for me. It is a brutal place to work, but I enjoy it. It's chaotic, but you see the interventions that you put in place to help patients, and you see the recovery right away. It's very satisfying.
And it's in the hospital, right? Which hospital is it exactly?
Rio Grande Regional.
And how long have you worked at Rio Grande Regional?
4 years.
And all these 4 years you've held your current position, or did you work other positions prior?
No, I became a charge nurse maybe my second year. My first year I was a floor nurse. You know, our ratio was 4 patients to 1 nurse, so I took care of 4 critically ill patients, and, you know, kind of advanced from there.
And what led you to pursue a career in healthcare?
It's funny because I always tell this story to my friends. My wife got pregnant. Um, I was in college and I was having a very real discussion with one of my older sisters, not knowing exactly how I'm going to raise a child without a good job. And she has already been a registered nurse for some years. She told me, why don't you get your licensed vocational nurse, which is a 1 year degree. Um, so I said, let's give it a try. I went ahead and did that. I enjoyed it. My wife also went through the same program I did. I'm sorry, she went through the same program I did after having our baby. So we were both in the nursing program, very difficult, very challenging, but we both managed to get through it. Um, and then we kind of stuck with it. We enjoyed it. We enjoyed helping people. So we got our nursing licenses together.
Awesome. So, I mean, as far as I understand in the media, let everybody else to understand, not all hospitals were accepting COVID patients when the pandemic first reached the valley. So at what point did Rio Grande Regional Hospital begin to accept patients?
We always accepted COVID-19 patients. There was never a patient that we turned away. Now, when we started not necessarily turning away patients, but being overwhelmed by our COVID-19 patients, like I said, it was in June to July. We had absolutely nowhere to put these patients. We had lobbies filled with patients. We had patients that were not oxygenating very well. They had O2 tanks with them in the lobby. We had beds in the hallways. Not enough staffing for all these nurses, for all these patients. So I was taking a full load of patients myself. All of us we were overrun, and we had ambulances waiting in our, emergency room for maybe 10 to 12 hours just to get patients beds, because we were just so inundated with patients that we didn't have enough resources to help them, unfortunately.
Were you given an option to work with the COVID patients, or to not?
So at first in our hospital, we had designated a green zone, which a green zone means are those patients did not show any signs of COVID-19. We do something called a COVID screen, which is basically checking their vital signs and then asking them routine questions if they've had fever, cough, congestion, shortness of breath, or been in contact with anyone with COVID-19. Now, if they screen negative, they went to our green zone. Now, if they were positive for those, then they would be in our orange zone. That worked for maybe, from January to June. And then when we got that flood, you didn't have an option. Everybody was working with COVID patients.
Is that when you guys were able to get in the COVID test?
We always worked with limited number of COVID testing. We had something in our hospital called PUIs. So sometimes when we ran out of COVID testing, we would consider people PUIs, people under investigation, because they presented with symptoms. Their chest X-ray showed, which became kind of the standard. Bilateral, opacities or bilateral pneumonias were usually the indicator that they had COVID-19 infections, along with fever, shortness of breath. Now, while these do mimic other symptoms, since other illnesses, we still had to treat them that way since our testing was limited.
Was the hospital prepared for such a pandemic, material and training wise?
No, there was no way. And I think I can speak for all hospitals when I say we weren't. We didn't have enough ventilators. We didn't have enough what we call high flow oxygen, which is basically kind of this prong that you put in your nose, and it kind of shoots oxygen up there to kind of help them breathe easier. We didn't have enough BiPAPs. We weren't ready for this at all. This area at all was not ready.
What about you? Were you prepared at any point during the pandemic with proper protocol and safety procedure training for COVID from your place of employment?
So there, though that was posted everywhere in the emergency room, they had procedures, they had, ways to put on our personal protective equipment, how to take it on, how to take it off, how to put it on, how to take it off. So yeah, I can say that our hospital in that aspect, they always provided us with enough equipment. We've never been short on that, So I think we were, in that regard, we did have enough personal protective equipment to handle it.
And did you ever imagine anything like this COVID pandemic happening when you chose a career in healthcare?
No, no, I don't think I foresaw a pandemic, or at least a pandemic to this extent, happen.
And has the current pandemic affected your decision to be a healthcare provider?
It only strengthened it, I think, because you see the suffering of people and you want to help them. It's hard to be in that position day after day. It wears you down, and I've had a lot of colleagues get worn out because of it. A lot of colleagues get sick because of it. It's not an easy thing to do. So, I respect the hell out of the people that I work with. Any nurse, all nurses in general. It's just a very tough place to work right now.
Yeah. So what other ways, is there any other ways the pandemic has affected your professional life?
Like I said, my wife and I both contracted it. We were out for 2 weeks of work, which was hard. We got a new house that we just purchased. You don't foresee these kinds of things. So yes, we were in a home for 2 weeks without our children because we sent them away. We have two children, 7-year-old girl and a 2-year-old little boy. We're just worried about them and their safety. But it was hard on us because we didn't know what to expect. We didn't know, how sick are we going to get? How far are we going to take this? Do we have to start discussing end of life decisions? What's going to happen? But I think when we came through it okay, it just made us even more, it strengthened that bond that we had.
Okay, like you said, unfortunately, that you caught the virus yourself. Do you think this happened at your workplace, or do you believe you caught it in some other way?
Most likely at my workplace. I one to kind of rush into situations without thinking. And I did that. There's a patient who wasn't doing too well on a ventilator, whose heart stopped, unfortunately. So we had to begin resuscitation attempts. I was in there without proper PPE, and that's most likely how I contracted COVID-19 and passed it to my wife.
Okay. So your wife caught the virus also. You say maybe possibly you passed it to her. Did your children were fine, or did they also catch
Yes, and as soon as we found out that we were both positive, we sent them to stay with my in-laws. Never had any symptoms. Thankfully, by the grace of God, they were okay.
That's good. And your wife is an RN in another hospital, and do you think her place of employment, or from what you hear from her, what she tells you, do you think that they have proper safety protocol compared to your hospital?
They are fortunate enough to have a large enough area to where their COVID patients are secluded from other patients. So yeah, I think that maybe their area where they work is better suited for them, which is a big relief for me. But yes, I think that where she's at, her hospital has proper protocols in order.
Better.
Yeah.
Something like that. Okay. So did the need for quarantine affect you financially, or did you and your spouse's place of employment have you covered?
So my place of employment covered me. It was called pandemic pay. It was 70% of my paycheck. Um, Unfortunately, that's not enough to cover all the bills. Um, Luckily, we did have some money saved. My wife did not have any coverage for her leave of absence or when she contracted COVID and we had to be out for 2 weeks. Mhm. So
So how did you guys handle, your spouse and you and the babies handle the separation during quarantine?
it wasn't easy. You know, we are, like I said, family is a big thing to me. I've never been without my children for more than a day or two.
Mhm.
Um, we would talk over the phone, but my daughter's at that age where she knows, you know, something's wrong,
Yeah.
and she was worried, but she was easily, you know, comforted when we would talk to her and things like that. My son, well, my son's too. He's happy wherever there's toys. So
Yeah. Okay. So I kind of want to focus on, since this is a project mostly for the Latin community, I want to focus on some details in what you've observed in regards to the Latin community. I mean, you also are a part of it as well as a Mexican American. So as a member of the Latinx community, how do your observations and experience interpret how Latinos in particular have been affected by the current pandemic?
I think that where we live is a heavily Latin community. Every patient that contracts it, every patient that dies is, you know, 3 and 4 Latin patients, Mexican American patients. So we are adversely affected. We are one of the more obese cities in the nation. We have a high rate of diabetes, even in children. Um, so we have, and very stubborn. People tell us to do something, it'll make us safer, and they tend to not want to do that for some reason. I did not know that putting on masks would be so highly controversial for some people, but it is. So every time I see patients, I remind them how sick they are, how sick they can be, and when the younger patients come in, patients that are my age, maybe your age, I let them know that, it's not about you getting sick. It's about people that you can pass it on to, because a lot of Latin communities have their grandparents living with them. Their mothers are much like mine with diabetes, hypertension. Some of them are immunocompromised, from kidney transplants. You know, I mean, almost every household has a family member on dialysis.
Yeah.
So these are all, you know, things that can affect our community as a whole. And I just try to stress to them how important it is for them to be safe, stay safe. If they go out, just be responsible. But stubborn, like I said.
Yes. And like you said, fortunately for the Valley, compared to other parts of the country, we are a majority Latinx community. But did you happen, or did you in any way see any difference in quality of care provided to Hispanic patients?
No, no. A lot of our, that's not an issue. That's never been an issue here. All the nurses that I've worked with, almost, 75% of them are Mexican American nurses. That's a non-issue. At least where I work, I can speak for myself, my staff, but no, that's not an issue.
And from what I understand, procedures in the hospitals have changed, such as the family's ability to be present and involved in a patient's health care. Has the lack of representation affected the quality of a patient's care?
So I don't believe so. I think that a lot of the times family members give us a good idea about what's going on. They give us better they give us better history than maybe the patients themselves, which is always something we can get via telephone. Um, but I always stress to them that it's more important for them to stay safe in an area that doesn't have a virus where they're taking care of their family member. And the last thing I would want for them is to contract COVID-19. But they are very helpful in that regard. They do know a lot of the patient's history, very good with medications and what medications they have and have not taken. So the family's always helpful.
So the fact that they can't go in there and see what's going on, does it make a difference? Do you think some patients are probably could be
as far as their care from us, I don't believe so, but I think it goes to the patient's state of mind. You know, you want to have somebody there. You want to have somebody to hold your hand, to talk to. Yeah. You know, when things are going really bad, you want somebody there. You know, just somebody you recognize, somebody you know. Mm-hmm. A lot of these patients who pass away without family or have to talk to their family on the telephone, yeah. It breaks my heart to see them alone. But we try to explain why we do it, but it just never feels right.
Yeah, I can imagine. So, like in the media and on social media, there was a lot of stories coming out of upset family members who weren't able to get in contact with their loved ones or even be able to get updated on how they were doing. Some claim to not hear back from the hospital until the patients had actually passed away. Was this an issue you faced in your experience, or was that out of your? Yes. Oh.
Yes. So at any one time, one nurse would have maybe 6 to 8 patients when the COVID pandemic was happening. So it was very hard for us to reach family. You know, a lot of the times they wouldn't provide us with phone numbers, or the phone numbers that were provided in our system weren't correct. A lot of them were waiting outside, not understanding why they couldn't see their family members or deceased family members, why they couldn't be with them. It all goes to us trying to explain to them, you know, that this is a very real virus that can lead to serious illness very quickly. But yes, we do our best to keep families abreast of everything that's going on. But at times, you know, we ourselves are just so overwhelmed because, as you know, like in the Latin community, it's not just the daughter that's calling; it's the 3 other brothers, sisters. You know, it's the cousin, it's the great grandma. It's like 10 people, 20 people calling for one patient. Yeah. And what we try to tell them is consolidate within yourselves to see who's going to call so that we can give you guys an update and you can tell everyone else. Yeah. Because I myself have updated 4 or 5 family members on one patient. And that's too overwhelming for us at a time where, you know, our healthcare system's hanging on by a string. Mm-hmm.
So there was also a lot of nurses and doctors on the front lines, like you, claiming that they were having to make decisions on whether or not to treat a patient. Did you have any experience with this type of situation as well?
So anyone that comes into the ER, we treat. We never turn anyone away. But like I said, there's times where our ER is just so flooded that we have to, you know, in the ER, it's not who comes first, it's who's sickest. And that's always what we try to do. We get our sickest patients. And unfortunately with COVID-19, everyone's sick. Everyone's oxygen level's low. There were times where there was patients having to be coded in ambulances in our ER base that haven't even arrived inside the ER. They were holding them for so long. And it breaks my heart to have to do those kinds of things, but I can't overwhelm my nurses, because if I do that, I burn them out and I have no one else to rely on. Fortunately, the state nurses came and gave us some relief. But you know, at that time, the damage had been done. A lot of nurses were sick. A lot of them we're hanging on by a thread. You know, this is all very emotional thing. It's a very emotional situation. Um, Seeing a patient that comes in, you know, talking, you know, walking, they're fine, you know, their oxygen level is a little low. And then maybe 10, 12 hours later, we're having to put a tube down their throat to help them breathe because they can't breathe anymore. So these patients aren't like other patients we've had where we can keep them in the ER for a while and they'll be fine. These patients deteriorate quickly. Our staff does our best to stay on top of that, but there's only so much of us. I mean,
Yeah. So, I mean, that all sounds rough, and it seems the entire world has been impacted with the trauma and hardship of this pandemic. How has this pandemic affected you personally, mentally?
um, you try to push through. You know, there's a it's hard.
I can't even imagine. I mean, we're out here and it's hard out here. I can't imagine how you feel being in there. But you're a superhero right now. So you can tell your kids that
Yeah.
mom and
I
dad are
mean,
superheroes, COVID-19 superheroes. And what about your facility? Are they providing its staff and nurses with any support for their bravery and
yeah,
hard?
you know, for the most part they are, but a lot of nurses, you know, I don't, for the most part, they don't really take up on it. They're so tired, you know, they just want to get home, see their families,
Yeah.
and get right back to it the next day. You know, that's all we can do.
Okay. So we're gonna move on to the final questions and get a little political, your political view on things. So first, I'm going to start off with, are you satisfied with the local response to COVID-19 in Hidalgo County?
I think at first we had a good handle on it. You know, the stay-at-home orders, the shelter-in-place orders, all that was really good. While we did see, you know, less and less people in the ER in the hospitals in general, it was a good tactic to get ahead of it. I think we did really well there. And then when all this reopening started, I think it was in May that we tried to reopen everything. And I think that's when our numbers started to tick up again. I think that was not the best move. I think that there was a lot more people they could have um, consulted about that, a lot smarter people than myself. Um, but all in all, I think in the beginning our response was really well. And right now, I think we're just gonna, you know, we haven't seen this that big of a spike like we used to, ever like we did. But you know, I'm hoping to avoid that with early interventions, much like we did the first time.
And are you satisfied with the state response to COVID-19 led by Governor Abbott?
I guess I can only speak to the valley and what I've seen firsthand. But like I said, the reopening in May, not the best idea. In larger cities, I think he also reopened and kind of is still holding that idea of keeping them open. I don't think that's the best idea, especially with flu season coming around and those two illnesses mimic one another hand in hand. So it's going to be very hard to differentiate which one's which. Um, I'm not saying that we should lock down people entirely, but you know, wear a mask, clean your hands. You know, these are little simple things that can keep you from coming to the hospital.
Yeah. And what about the national response? Are you satisfied with the national response
Oh,
to
definitely not. No,
by
no,
President Trump and his administration?
definitely not. No, you know, you know, it shows in the numbers how they're jumping up, how many people are dying every day. 11 million cases, I think I saw on CNN today that we've surpassed. So no, we're not doing a good enough job when we're belittling scientists, people that know this disease a lot better than we do.
Mhm.
I mean, how are we going to get a hold of it if we don't trust the very people that know this virus in and out, and how it affects people and how it's transmitted? You know, these are
Yeah.
very simple things that, you know, don't need to be controversial.
Yeah. Okay. And if you had the power to respond to COVID-19, what would you do differently, if anything?
Just get ahead of it, you know, lockdown, you know, no more, you know, shut down the bars for a little bit. I don't think that it's important for there to be bars open, you know, only go out for essentials, you know, mm, little things like that. I mean, I'm not asking you to lock people in at home for 2, 3 months at a time, but safety measures, you know, stay safe, mask, gloves, clean your hands all the time. I mean, these are just simple things that you tell your 12-year-old to do.
Yeah. Okay. So this is a special year in our national democracy because it's a presidential voting year. Did you vote? And if so, did you notice or do anything different because of COVID-19 pandemic?
I did vote. Um, I don't think COVID-19 necessarily dictated who I voted for. But I think that I'm hoping that the response is different. Um, you know, we live in a very different place down here. It seems isolated from everything that's going on up there. We seem like we have our own economy, our own everything, that we're really not affected by national news. So when something like this happens down here and that their policies are starting to affect down here, I think that people are starting to take notice. And I think that's why the voting in this area went up so much, because they know, you know, policies matter. You know, people making those policies need to understand that we have a voice, that we matter.
Mhm.
And I think that they made that loud and clear this election.
Yeah. Okay. Well, is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about?
No,
Nothing?
that's about it.
Well, that was some amazing information you gave me, and thank you so much. I'm going to end this.